Before they'd even got to the starting line, the St Leger Festival in Doncaster had run into trouble. 2,500 spectators arrived today as part of the government pilot to see how sporting events could be held in times of COVID-19. But from tomorrow, the horses and riders have been put behind closed doors following the intervention of public health officials. The memories are still fresh from the Cheltenham races in March, widely criticised for being allowed to go ahead and blamed for spreading the virus. It was just like old times, the Chief Medical Officer and the Chief Scientific Advisor flanking the Prime Minister in Downing Street for a major announcement.
Good afternoon and welcome back to Downing Street for an update on coronavirus as we enter autumn and approach winter. In England, from Monday, we're introducing the rule of 6. You must not meet socially in groups of more than 6, and if you do, you will be breaking the law. This will apply in any setting, indoors or outdoors, at home or in the pub.
There will be fines of £100, though there are exemptions, including weddings and funerals. Police forces had complained that the current guidelines were confusing and too difficult to enforce, and this pub manager agreed, welcoming the rule of 6.
It's good to hear because enforcing those rules before they were law was difficult. A lot of people don't care about COVID anymore. A lot of people don't care about social distancing and so on and so forth. So trying to regulate large groups of people, even though they were like groups of 6 were like guidelines really, and because of that, no one really takes it seriously.
It does mean the 4 nations are once again following very different rules.
If you're meeting outside, in England from Monday, you must meet in groups of no more than 6 people from multiple households. In Scotland, it's up to 15 people from up to 5 households. In Northern Ireland, it's also 15 people, and in Wales, it's up to 30 people. If you're meeting indoors in England, no more than 6 people from multiple households. In Scotland, it's 8 people from 3 households. In Wales, 4 households can form a single extended household, and in Northern Ireland, it's 6 people from 2 households.
But could the rule of 6 have been avoided? Yes, if only the test and trace system was working, according to this expert.
And I think that is exactly why the government's doing this national restriction. They wouldn't be doing it if they weren't really worried. I mean, they spent the summer saying, go out, spend money, mix, go to... I mean, it's not like this is in their game plan. We absolutely need to get testing working. I mean, I'm just really worried that just now we're not in a position to test the people who need testing.
There was testing in Bolton because they have the highest numbers per 100,000 in the country, but elsewhere people are being offered sites hundreds of miles away or aren't able to get an appointment at all. And yesterday we were told via a tweet that it was a problem with the labs. Today the Health Secretary said it was because people without symptoms were taking tests when they shouldn't be. However, the Prime Minister today promised a moonshot. Tests galore to get us out of this, even by Christmas.
In many ways, we could be able to get some aspects of our lives back to normal by Christmas. And I talked just now about how you could do that through that moonshot of daily testing. Everybody gets a pregnancy-style test, a rapid turnaround test in the morning. 15 minutes later, you know whether you're infectious or not.
It's not an enviable position to be put in, but not for the first time the Chief Scientific Advisor felt the need to rein in some of the Prime Minister's enthusiasm.
There are, as always with technologies, unknowns, and we would be completely wrong to assume that this is a slam dunk that can definitely happen.
So the spectre of a pregnancy-style test in the morning, perhaps the reality the Prime Minister's advisers said was that the period between now and spring would be very difficult.
Well, the Labour Party leader, Sir Keir Starmer, said tonight the rise in infection rates was deeply concerning, and he urged the public to follow the new rules.
I think the government's now acknowledged that their poor communications were a large part of the problem, so that's got to be fixed. But they also need to recognise that the testing regime is all over the place at the moment. They can't pretend that's not a problem, so that needs fixing as well. But we support the principle of the measures, and we ask everybody to follow those rules.
Well, our health and social care editor, Victoria MacDonald, joins me now. Does Sir Keir Starmer have a point or not?
Well, you have to give the government some credit because they have acted quickly in light of the fact that the cases are going up quite steeply. We saw some very stark graphics today in that Downing Street press conference, and particularly in the 17 to 21-year-olds. Now, they'd want to avoid a national lockdown, so this is their way of doing it. Where the government has gone wrong is not having clear messaging up until now. And they are not admitting where there is a problem. So let's take the testing. There is quite clearly a failure in the testing system, and they won't tell us what that testing system is. Instead, today we had the Health Secretary blaming people for going to have tests who didn't need them. Then we had the Prime Minister talking about a moonshot, this idea that we will all be able to have a test in the morning, show that we're negative and go out life as normal. Moonshot. I would say slightly more pie in the sky, and they need to be really careful about this because we were promised, remember, those antibody tests that were going to be our saviour. Did those happen? They certainly haven't happened yet. And we saw again the Chief Scientific Advisor and the Chief Medical Officer having to dampen down slightly the Prime Minister's enthusiasm that we can have Christmas as normal, because it is far from clear that that is going to happen.
Victoria, thanks very much. So all of this is an attempt to move beyond a summer of confusing messages and prevent another national lockdown. But how will the changes impact on everyone's lives? Aisha Tull has been finding out.
Happier times for Jade Patrick's family. Before lockdown, of course. They'd been hoping to throw another family party to celebrate her grandparents' 50th wedding anniversary in a few weeks' time. In terms of your grandparents, what will it mean for the celebrations you had planned?
So when that was then booked, and then obviously Mr. Hancock said that, it was really just devastating for us because we were also looking to being back together for the first time since January, really, or February would have been the last time we were all been together. And it was just really devastating that, you know, we couldn't do that.
When's the next time you'll be able to see your family and extended family?
Not sure. It's my nan's 70th in December, a few days before Christmas. So I think, fingers crossed, we can all get back together then. I know Boris Johnson has said that fingers crossed everything will be normal again by Christmas. But realistically, I'm not sure about that, so we'll just keep everything crossed for Christmas.
And Jade isn't the only one feeling frustrated by the latest changes.
Me and my nan, we've said it's ridiculous again, to be honest, just with the changes that's going on, you know, it's...
And if it's that bad, why has he left it till Monday to do it?
Yeah,
Why not do it straight away?
It's so confusing for everyone. It's like, OK, hot weekend coming, you know, and everything going on, and sort of Doncaster going ahead and everything today. It's so confusing.
It's been difficult in the first place, and now it's going to be more difficult because so many activities we've cut off because of this.
It will affect a lot of other people's life, but you have to do what you have to do in order to keep everyone safe. So, yeah.
The change is so constant and so often that it's just really difficult to keep up.
I'm Spanish. I've just come back from Spain on holiday, and everybody there takes it way more seriously. Like, you have to wear a mask all the time, even if you're just walking about on the street.
For some months now in Spain, officials are not just making sure masks are worn, but giving out fines to those who won't. This afternoon, as part of a push for stricter enforcement, the Prime Minister said towns and cities in England will soon see marshals in place to check everyone is following the new regulations.
Well, we did ask to speak to England's Health Secretary Matt Hancock or a health minister from his department, but they wouldn't come on the programme. I did speak, however, to Jenny Harries, who's the Deputy Chief Medical Officer for England. I asked Dr Harries first whether the Prime Minister's ambitious moonshot testing plan was about as achievable as putting someone on the moon.
So I think the moonshot ambition is quite right. We want to have the best approach we can in the country to managing coronavirus. But actually the announcements he's made today are very much more about in total about how we should live our lives and go about as best we can in normality, whilst introducing some simple rules. And one of the things that we are doing is obviously limiting the number of people in a group. That's an important one, but also launching a new campaign on hands, face and space.
I'll come back to the new rules in a moment, but I just want to finish up on testing, because it's not clear to me what is going wrong with testing at the moment. Is it a problem of lab processing, or is it a problem of too many people coming forward to get a test?
So there's an assumption things are going wrong, and I think a process that is as big as our testing ambition and capacity is bound not to be quite right all of the time. But we need to just think where the testing has come from. And in this country, I think we've now done over 70 million 600,000 tests. It's one of the largest testing capacities and activity of any country per head of population in the world. So I think that overall this is an achievement, and clearly we want to improve that and continue to take on board new testing. But it is working and it's linking into our test and trace capacity.
Do you think people were confused by the messaging in the last few weeks?
So I think people always like clarity, and both the message about the rule of 6 and also the hands, face and space campaign that is coming on board, both of those give very quick ways for people to remind themselves of the rules. In workplaces or in schools, there are rules and controlled environments, but when we're on our own, in our families, in social places, sometimes we forget that and we drop our guard. So it's a clear way to remind people.
Any chance of normality by Christmas?
So I think it depends how well we all behave, I think. If we're all very observant of those rules, then hopefully we will manage to keep the rate of disease in the country quite low and flat. But there is an ongoing risk, and I think we need to be mindful. This may go on for several months, and we do need to keep very cautious behaviour as we go through the winter period.